rapidly aging populations and decreasing numbers of staff, hospitals must adapt quickly to face challenges and improve the quality of care. Such challenges include responsiveness in patient care, increasing staff efficiency within a resource-constrained environment, nurses need to be reachable at all times, it takes too long to notify a physician of a patient's critical condition, staff has to juggle through complex infrastructure with multiple handheld and wireless devices, and vitals need to be readily available for staff. When hospitals use Deltapath Acute and integrate our solution into their existing nurse call system, response times between patient and staff improve due to faster communication. In this scenario, the patient is using the nurse call system remote and requesting to use the washroom. The nurse will receive a call and will then go and assist the patient. If the patient falls while in the washroom, they can press the emergency button located nearby to call staff for assistance. If a patient starts going into cardiac arrest, nursing staff can get a hold of nearby doctors quickly by pressing the emergency wall button located next to the patient. When the emergency button is pressed, it triggers an alarm located outside the patient's room and immediately sends an emergency call to nearby doctors. With Acute, all doctors receive the call at the same time. This allows any doctor who answers the call to guide first responders through steps necessary to stabilize the patient until the doctor arrives to the patient's room. Once the patient is stabilized, the nurse can then press the reset wall button to turn off the alarm before the doctor arrives. Nursing staff will now be reachable without having to carry any other device. Using Acute, they can also receive and make calls to other nurses. If a nurse forgets to set their unavailable response, they can easily decline a call and send the reason as to why they are unable to answer the call to the other nurse within seconds. This reinforces strong communication and more collaboration with staff. When a doctor sends the patient's test to the lab for further analysis, the data goes through a panic value system. The panic value system will detect any anomalies and immediately send the panic value notification to the patient's medical group. Staff will receive the notification and select Acknowledge, thus establishing accountability for immediate action to take place. In this scenario, the doctor notices that the panic value system detects abnormal levels that would indicate that the patient has acute appendicitis. The doctor can then take immediate action by using push-to-talk to notify the emergency room group to prepare for immediate surgery. Improve quality of care by enabling faster communication between patients and staff with Acute. For more information, go to deltapath.com. Follow us on our social media and subscribe to our YouTube channel to stay up to date on all Deltapath news.